Hello, Dr. E from Rockwood Natural Medicine Clinic, and today I want to talk about some cases and priorities. So we've all got them, right? And if you aren't sure what your priorities are, think about what you spend time, money, and energy on. Those are your priorities. And if there's a mismatch to what you say your priorities are and how you're spending your time, money, and energy, that should be an eye-opener, because when there's a mismatch, it creates stress. So newsflash, that's probably creating stress in your life. So today I want to challenge everyone, think about your wording. When you say, I don't have time to exercise, I can't afford my healthcare appointment, or you name it, insert whatever. I want to challenge you to change that wording to, I'm not willing to prioritize blank, or it's not a priority for me to blank. Big difference, right? So if our priorities are all different. For me, obviously, I like to practice what I preach, so I will always find the time and money to focus on health. But you know what? I can't afford to go to a Starbucks drive-thru every day because it's not a priority for me. And I think it's ridiculously overpriced, right? Whereas other people would say the exact opposite. Different priorities, that's okay. So today I want to talk about two patients in particular, similar because they both have type 2 diabetes. They're both females, similar ages, but drills in the point about priorities. So one of them has had uncontrolled blood sugars for years, multiple medications, and she's seen me multiple times, but it got to be, there came a point where I really had a little come to Jesus talk with her, because I love seeing drastic results in patients, and when they follow treatment plans and follow through, they see drastic results. And this particular patient had excuses month after month, and I finally had a little come to Jesus, and she showed me some labs that were showing that she was in stage 3 kidney failure. It didn't matter what I said before that point. She had to have that moment of, wow, I could be on dialysis. This could be really detrimental, life-changing, okay. And you know what? Her priorities shifted. I don't hear any more excuses about diet or exercise. She's done some drastic changes, and her stage 3 kidney failure turned around in a matter of weeks. So, because she did the work and her priorities changed. Another patient, similar but different, she had every excuse in the book. She didn't have money for healthcare appointments. She didn't have money for treatments. She was taking care of everybody else because that was a priority for her at that time. It wasn't until her blood sugars got so out of control that she finally reached out for some help, and within 3 weeks, things have completely turned around. Her blood sugars are better than they've been in years, but it wasn't until she developed the neuropathy, the tingling in her fingertips. Her vision was changing. Her energy decreased. So there was drastic changes that made her priorities shift. And this video is for all of us out there. It's a great reminder to myself that whenever we say we don't have time, money, or energy for blank, shift that wording around and see how that affects you, or how your priorities change, or maybe it just makes your priorities more apparent. So hopefully that helps shed some light. And if you learned anything or are curious about anything in the future, please comment below. Give me a hello or a like. I see people waving, but I typically don't mention because I find that disturbing to the videos. But hello, I'm thankful you're watching. Hopefully you learned something. And may your priorities and actions match. Have a good one. Bye-bye.